With more and more Zimbabweans based abroad coming back home in the face of the COVID-19 global pandemic, the number of COVID-19 cases in the country continue to rise, and also obviously putting the country in a catch-22 situation. Should we continue to receive returning residents? Should we close off the borders to our people? Well, to answer these and other related questions, I am joined by the COVID-19 Chief Coordinator in the Office of the President and Cabinet, Dr. Agnes Mahomva, and we also have the ZRP National Police Spokesperson, Assistant Commissioner Nyathi. Thank you for joining us today. Dr. Mahomva, on Wednesday we had a sharp increase of 76 cases, from 56 cases to 132, and today we're already at 149. People are alarmed at the increase in numbers of infections. What's going on?
Thank you, Abigirl. People should not be alarmed. Remember, from the very beginning, we said we were preparing, while we're also responding to the few cases that were identified. We were preparing because we knew we'd get large numbers. We talked of the trajectory, shooting up and eventually settling and coming down. This is just the upward trend that we're talking about, so it should not surprise anyone. We are grateful that our data in terms of our testing and so on, it is very clear where we're getting those numbers. Yes, we now have a total of 149. Where are they coming from? Yesterday, the total new cases of 17, they're all imported cases from Mozambique, from UK, and so on and so on. So it is important for us to realize that when we look at our data, it helps guide us, strengthen our preparedness in response. So as we're speaking, it's very clear that the high-risk area is the port of entry. The high-risk population are returning residents, and hence we need to work very closely with the police, for example, to ensure that as we put those returning residents in quarantine facilities, they are well managed efficiently and effectively, that they don't escape, and if they do, somebody really goes after them, not to punish as such, but to really ensure that they are aware that they're actually risk to their families where they're running to, and the communities to also know that if you get someone coming out from outside and they haven't gone through quarantine, you really must facilitate and ensure that they do. They're tested, they get into the quarantine, they stay there until they're clear. So we should not panic, we should not get alarmed, we should be grateful that the data that we have is clearly showing us where we need to focus, and hence we should now focus on that.
Any plans in place to curb the new infections?
The way we curb new infections is to ensure that if we do have, and yes, you did say, should we allow the returning residents to come back? Absolutely, this is their home. Where else can they go? If the country where they're coming from, they're saying, please, we don't want you here, go back to your home. What should they do? They should come back home. And so when we get those returning residents, whether they are thousands positive and so on, we must quarantine, manage them effectively and efficiently so that they then don't spread the infection to the communities. That's how we curb the increasing numbers. If we're not careful and we don't manage our quarantines efficiently and effectively, and they're all over the communities, then yes, we will have failed in terms of curbing the new infections. And that is our strategy, managing those quarantine facilities efficiently and effectively. And believe you me, we seized with that. Just yesterday, the day before yesterday, we're working frantically to ensure that we have an integrated guideline. We did have guidelines here. Ministry of Health had its own, the police had their own. But when we really looked and said, so what is it that we need to strengthen in terms of managing the quarantine facilities? We said, okay, let's just ensure that our tool that we're using, our guidelines for managing that whole process is a properly integrated one. And I'm happy to say we already have a draft and we're just moving forward with it, ensuring that we continue to work as a team.
Coming to you, Assistant Nyathi, we have heard reports of people escaping from quarantine centers. How many have escaped so far, and have you managed to catch any?
Thank you very much, Abigirl. As of this morning, the number of escapees is now at 148. Some have been arrested, some are being traced, and we want to appeal to members of the public. We want to appeal to communities that this is a collective responsibility We all need to consider the health and safety of all Zimbabweans. Let's not accept the returnees who are escaping from isolation centers. Let's not accept returnees who are escaping from quarantine centers. Let's have that community policy concept, that responsibility, where we all need to work together with the Ministry of Health and Child Care, with the police, with other security services, and the relevant stakeholders, and report people who are running away from isolation centers, from quarantine centers. We are quite aware, Abigirl, that some of these people are taking advantage of the opportunity which they are given to refresh as they are at the isolation centers or quarantine centers. Some of them are also taking the opportunity to use the porous fences, the porous walls, to escape during the night. And as a police, we have records, we have profiles which we access through the Ministry of Health and Child Care to follow up on these people. So definitely we are appealing for cooperation from the community.
We've heard of rumors of bribes in these quarantine centers. How far true is this, and have you made any efforts to follow up on these rumors?
Firstly, the Zimbabwe Republic Police do not condone any acts of corruption, any acts of dishonest by police officers or other security service members. So those who will be found to be engaged in such acts will certainly be arrested. They will face disciplinary action. They will also face criminal action, and above all, they will lose their jobs. But at the same time, I want to urge the returnees to be responsible. Their parents, their brothers, their sisters. There is no need for one to be reckless, especially with the COVID-19 pandemic. Let's listen to what is being said by our health experts. At the end of the day, we will pull through. But if people are not taking these issues serious, definitely we will continue to have people escaping, and definitely they will be arrested and taken to the courts.
Dr. Mahomva, we have 140 people who have escaped from the quarantine centers. What danger do they pose to the community?
If you're looking at the numbers that were issued yesterday, 149, a total of 70 new cases yesterday. Those are high numbers. That is the risk. If you have returning residents, a large number are positive, they escape and go into the communities. The big risk is them transmitting the infection to our populations, our communities. And once that happens, we have that local transmission. It can spread like wildfire. It really can. And we are saying in those communities, you've got elderlies, you've got people who have other conditions, and so you're exposing those people to such a condition that they might then not be able to recover from. We are saying if we manage them and contain them, and yes, I like what he has just said about it. Communities need to be responsible. Remember, this is not government doing this for government, or government trying to strengthen how we respond and prepare just for the sake of it. This is for you and I. This is for the communities. So if you're out there and you're not appreciating that what all these measures that are being put in place, the restrictions, what have you, quarantining your brother, your sister, your daughter when they come back, it's for your protection. If your daughter comes into your home and you think they're looking good, they don't look like they have an infection when they have it, but there you are busy managing or nursing your high blood pressure. You are so happy your daughter has come, you're embracing, they are positive. They can then give it to you, and before you know it, they might then survive because they're young and vibrant and they recover very well, but you might not. And how unfortunate that you then won't be able to see your grandson because you've gone, because you've allowed your daughter to come in your home. Let them be quarantined. You will see them in good time. Once they have recovered, you have plenty of time to reunite, plenty of time to have so many celebrations. So it's a message to the communities that we're really now emphasizing. It's for your good. Anyone who's coming, be the first to really even tell the Ministry of Health, police, or whoever that I've got my daughter who's just arrived. Maybe they didn't quite know how they arrived. They didn't know that they need to be in quarantine. Whatever the reason is, just work with them and ensure that they go into quarantine facility. Remember, we have now also opened quarantine facilities being manned by the private sector. When we started, people were really saying, well, the government facilities, maybe they're not good enough. They are good. They have the basic things that are required for you to live in. But if you want that a little bit extra, there are those private facilities that are now being designated where you can also use and hence protect your family, the community, and Zimbabwe at large.
Ask Nyathi, how are these people escaping from the quarantine centers?
We are conducting investigations at Abigirl, but one of the issues which we have established that, as people are at these isolation centers, as they are at these quarantine centers, they are given the opportunity to refresh, they are given the opportunity to interact, they are given the opportunity to mix and mingle. In the process, they take advantage and then escape. We have also established that during the night, instead of sleeping, some are not sleeping. They then use the porous fences, they then use the walls where some jurors, they need the attendance, they need the repair, then they escape. So the security services have intensified the patrols. We have increased the deployment, and we are also saying where there is need for lighting, we also engage the relevant authorities, the local authorities, the Ministry of Local Government, to assist to ensure that we have adequate lighting, particularly during the night, so that our officers, when they are on patrols, they're able to see what is happening. They're able even to observe movements. So this is one of the areas which we are working together with the Ministry of Health and Child Care, the Chief Coordinator here, the local authorities, to ensure that we have adequate lighting at these isolation centers.
Are there any measures put in place to trace the escapees?
Certainly. Amongst the 148 returnees who have escaped, we have traced them, and we are continuing to trace them through the addresses given, through their next of kin, and also their colleagues. What is of concern, Abigirl, is that some of them are not even going to their homes, and we are wondering where they are. And in this process, it also increases the chances of spreading COVID-19, as alluded to by Dr. Mahomva, something which is really of concern. So that's why we are emphasizing the issue of community responsibility, the issue of community policing. Let's have, this responsibility of reporting. Even if it's my brother, even if it's my sister, no matter that is the one who is providing for the family, he may fail after somebody, gets affected by the COVID-19 pandemic. So let's work together with our health experts, report, people are attended, they are treated, at the end of the day, we enjoy as a family.
Okay, still on the escapees, we understand that with the cases of COVID-19, the names are withheld, doctor, patient confidentiality, yes, we understand that. But is it not prudent for public safety to name these people? For example, if Abigirl Tembo is kept from quarantine, then if somebody is to see Abigirl Tembo on the street, then it will be easier for them to alert the police. Don't you think for public safety it is prudent to name these escapees?
With the increase in the number of escapees in Abigirl, like for today we are 848, definitely working together with the Chief Coordinator, with the Ministry of Health and Child Care, we will publish the names. Definitely we will do so. And I want to urge the community, I want to urge relevant stakeholders to support the Ministry of Health and Child Care, to support the Zimbabwe Republic Police, to support the security services, such that when we publish these names, whoever is hiding, whoever is assisting them to escape or to hide will come out and reveal the exact location of some of these escapees.
Coming to you, Dr. Mahomva, people are escaping from the quarantine centers. What's the state of our quarantine centers?
They are indeed, as he's just told us, the numbers that they have recorded. Our quarantine facilities are reasonably managed with the resource that we have. They are not 5-star hotels, as some would have wanted, but that is the reality. What our focus is on those quarantine is to really make sure that they're clean, they're habitable. Remember, when they are designated, they are actually first inspected by our health teams with the labor and social welfare, who actually identify and provide those facilities. So they are very much fine. However, there are those returning who would like to live in a 5-star place or something like that. This is one of the reasons why government has gone on to say even some private facilities, lodges, can be designated. Our teams then go in with the Ministry of Health and Child Care, Labor and Social Welfare, and of course the police there to look at the security aspects, labor to ensure that the social aspects and so on are in place, health to ensure that the health issues are also in place. So those private facilities have also been designated. So really government is doing the best it can. We have noted as the large numbers continue to come in, that we are now a bit stretched. We were struggling with that. We will never run away from the challenges and the gaps that we have in this preparedness and response initiative that we're in. We always say it. We were struggling, but we jump in the minute we identify a challenge, a gap, and we address it the best way we know how. So we're doing that. We have just re-looked at our standard operating procedures, our guidelines in terms of how do we manage to be more efficient and more effective. And we actually now have a finalized draft, integrated guideline in terms of what is it that we need to do as a team, health, the security forces, labor and social welfare, to continuously improve. In fact, some of the complaints that come from the residents in those quarantine facilities actually alert us to some of the issues that we might not have identified, and we move on to address. We're appealing to the public, we're appealing to the residents to say, help us, because we are working on this together. We will never say we don't have any challenges. They are there, but we aim to address them every single time we identify them.
Okay, there are some reports, social media reports, that these people are running away because there is hunger in the quarantine centers. How far true is that?
We hear that and we immediately go and investigate. So we've heard that, and of course our labor and social welfare is on it, re-looking and saying, what is it? Which facility? Is there any? I can talk of ZIPAM, which is really one of our best case scenarios where we like to showcase it as an example of how things should run. They're doing very well. So is it about the management of one particular facility where people are just failing to do what they should be doing? Or what is it? So that's what we do. When we hear these rumors, we don't brush them aside. It is very possible there's a facility where they're really struggling with food and so on. Is it because they're not able to manage their affairs properly or not? What is it? Once we identify the gap, the challenge, we jump on it and address it. So one, we don't run away from the gaps and the challenges. We listen very carefully to those who are complaining, whether it's the residents or the community. We jump on it and look at it. We were told, you know what, maybe the management in there is not quite running well. There's a bit of siloed approach and so on. We jumped on it. We looked at our guidelines, our SOPs, and we immediately revisited and we say, okay, here's a streamlined one, so that we're able to manage them efficiently and effectively. So once again, the message out there, please continue to bring in any challenges that you might be seeing, any gaps that you're seeing in our facilities, in the way we do things, so that we relook and address them in line with the resource that we have. Yes.
In the quarantine centers, we understand these are now the hotspots, right? Mm-hmm. Where are the positive cases being put? How are the positive cases being managed in the quarantine centers?
So when the returning residents come in, they're put in the quarantine facilities, they must be screened first. If you are positive, you should be immediately separated from those. In other words, there should not be any mixing of those who are negative and those who are positive. I am aware that in some quarantine facilities, people have complained that they're still there. But what has happened, if we are having challenges with the isolation facilities, remember when we're saying quarantining, it's everybody who is coming in, we don't know your status. We just assume you're negative. You're there. But the minute you're tested and you're positive, you immediately separated. Those who are not remain in the quarantine. Those who are positive must be now taken to the isolation health facilities or other designated isolation facility. That's what happens. If for some reason those facilities are not quite ready or there's a bit of a challenge, there's still that separation in the same quarantine facility. Now you have perhaps what we call the green and the red zone, where you have separated. Just like we're doing at Paranato Hospital, for example, we have divided the hospital into the green and the red zone. In other words, you have a portion of it that is managing people who are not COVID positive, but you have a portion that is managing, isolating positive cases. It's the same principle. You need to be innovative when you know your resource is not what you want. So you know your resource is not what you want, but you know you shouldn't mix up people. You separate them. It might be in the same facility, not ideal, but you must separate them, red and green zone. And then gradually you make sure that you have those other designated facilities or health institutions where you literally move them and take them there. So those are the things that our communities need to be aware of, not to panic. But indeed, if they suddenly realize, no, in this quarantine people are mixed up, let's hear about it, because it should never be like that. People just need to be separated.
Shortages of reagents worldwide. How has this affected Zimbabwe?
Thank you for that. It's a big challenge. You know, the big nations which have the largest numbers, the Americas, for example, quite clearly with their economic muscle, they can mop up all the resources, the commodities that are required because they have the money to pay. And then when we come along, we struggle to get whatever little that is left and so on. But as a government, we have decided, you know what, we can't just keep crying. Yes, we'll keep ordering and trying to procure whatever is out there, which we can't produce here. But we're now prioritizing local production. You notice a large percentage, 99 if not 100% of all sanitizers now are being produced here in Zimbabwe. We produce alcohol. Remember, the sanitizers, the big ingredient there is the alcohol. We produce alcohol here, there. The companies, universities are busy producing sanitizers. That's how we're managing it. They're also busy producing masks. That's how we're managing it. In fact, when we eventually get rid of COVID, we will probably have a good new normal where we have now also revamped our industry to produce not just for COVID, but they will now be able to continue running with other things that they were supposed to produce. So it's innovation, it's ensuring that we're using what we can, and it's continuously re-looking and saying, we don't have this, but we need to do X. The right thing at the right time in the right place is what we're doing with the resource that we have. We can never fail.
All right, coming back to you, Assistant Commissioner Paul Nyathi. People are all over town. Is the lockdown over?
Certainly not, Abigirl. And I want to urge members of the public to listen to what is being said by the Minister of Health and Child Care, and also to take note that if there are any changes in terms of the national lockdown regulations, the President, His Excellency, Comrade Idi Mnangagwa, will certainly make the appropriate announcement. So as it stands now, only people who are going for work, in the work which has been clearly outlined by the government, which is those in the industrial sector, mining sector, commerce sector, are supposed to be going for work. And they should be having letters from their employers, from their directors, from their CEOs, so that it assists the security services to know who is who. You know, the challenge which we have, if you look at the figures, yesterday we had 449 people who were arrested, mostly in CBDs, for not wearing masks. We have people who are now moving around aimlessly, without a reason, without a purpose in the CBDs. And in the process, they increase the risk of spreading COVID-19. So we are urging people to stay at home. We're urging people to put their safety first, their health first, so that at the end of the day, the nation manages the COVID-19 pandemic.
Back to our escapees, how can the public get in touch in the event of a suspect prowling on the streets?
At the national level, there are numbers which have been given by the Ministry of Health and Child Care. There are, the information centers which are being nationally managed, and we want to aid the public to get to know those numbers. And one of the numbers, I'm told, it's 2019. And also, the Zimbabwe Republic Police has got a national complaints desk which is manned 24 hours. The number is 703-631. 703-631. And if they are outside the Harare, they please 0242. 0242. We also have a WhatsApp platform 0712 800 197. 0712 800 197. Then we have police and other security services who are in the provincial task committees. So people should also report to the provincial and district task committee so that at the end of the day we account for these escapees. I want to honestly and earnestly appeal to the communities, traditional leaders, business people, to report. This includes people who are smuggling, groceries, people who are, evading customs and exercise points to come into the country. They are not checked, they are not inspected. At the end of the day, they also spread the COVID-19 pandemic, which is really, really, a concern to the police, a concern to the Ministry of Health and Child Care, like what the Chief Coordinator has said. So let's work together, the Ministry of Health and Child Care, the police, and the safety services, relevant stakeholders, to account for escapees. Police officers will be moving out to conduct awareness campaigns in consultation with the relevant stakeholders. So let's all join hands and ensure that communities are safe, communities are secure. At the end of the day, the nation is able to manage COVID-19 virus.
Thank you very much, Assistant Commissioner Paul Nyathi and the Chief Coordinator in the Office of the President Cabinet in the COVID-19 response team, Dr. Agnes Mahomva. It is an appeal to the nation. Let us all prioritize our health, report any suspect, and be your brother or your sister's keeper. Thank you for watching. Stay safe.